Interpreting an arterial blood gas is a critical skill for nurses. It is more than just simply looking at the pH value of our patients. It's about understanding what's driving that imbalance and if or how our body is able to compensate for it. Today I'm going to teach you a 4-step process so that you can understand what's happening with your patient's acid-base balance right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Now before we can start into how to interpret an arterial blood gas, it's important to understand the factors that we're looking at. So there are 3 regulating systems in our body that help us maintain that perfect environment for our cells to function normally. These are called buffer systems. The first of the 3 buffer systems is the fastest to react. We have the chemical, which is also known as plasma buffer system. And here we see carbonic acid is the intermediary between hydrogen and bicarbonate and water and carbon dioxide. Now carbon dioxide we know is excreted by the lungs, and so this leads to our second buffer system known as the respiratory system, in which it will either retain or remove CO2 to keep us balanced. The third system is the kidneys, which we call metabolic system. The metabolic system will retain or remove hydrogen and bicarbonate to keep the acid-base balanced. Now, if any one of these systems goes out of balance, the other 2 will try to compensate to maintain that acid-base balance so that our body can function at its maximal capacity. Next, we need to look at what our normal values are and what happens when I'm outside of normal. We're going to start with pH. pH is just generally an overall status of where our acidity is in the plasma. Now my normal range is 7.35 to 7.45. So if I am lower than that, I have an acidic environment, and that means I have too many positive ions in the blood, and one of the biggest ones is hydrogen. So there's an inverse relationship to the number of hydrogens and the pH value. Another way to think of this is I have too little base, then I am acidic. Similarly, if I am higher than 7.45, it's considered to be an alkalotic environment. The second category is CO2. This is our respiratory system. This is a direct measurement of hydrogen ions, and here, if I have too many hydrogen ions, I am greater than that normal value of 45, and I'm considered to be acidic. If I have less than 35, I'm considered to be alkalotic for CO2 levels. Now the last one is bicarb, HCO3. Bicarb is base, so if I have too much base, I am alkalotic. If I have too little base, I am acidic. Now we're ready for the 4-step process. Simple steps. First is to check each of those levels to determine if they're normal or abnormal, and if they're abnormal, which direction are they going? From there we can name the imbalance and determine if there's compensation. Let's work through this with an example. So let's take this example here, a pH of 7.24, CO2 of 48, and bicarb of 23. I'm going to use my table here to help me out. The first thing I want to do is check my pH. I see 7.24 is lower than the normal range, which means I have an acidotic environment. I'm going to go ahead and label this with a downward arrow and put the word acid beside it. So let's do the same for our CO2 and bicarb levels. CO2 48 is higher than the normal value. I put an upward arrow and label it as acidotic. And bicarb 23 was in the normal range, so I'm just going to put the letter N. Now to name the imbalance. I know I have an acidosis because my pH tells me there's an acidotic state. I need to identify, is it my respiratory system or my metabolic system that is driving this change? So for that, I look to see which value is also acidotic. My CO2 is acidotic, which means I now have a respiratory acidosis. Now the other question is there compensation? To determine this, I need to look at the opposite system, the bicarb, my metabolic system. Because the value is still normal, there hasn't been a shift yet in the kidneys to help support this imbalance, so we would call this a non-compensated respiratory acidosis. All right, so let's try another one. My pH of 7.29 is low. I'm going to put a downward arrow and write acid. I now know I have an acidosis. I'm going to figure out which one. CO2 level 35, that is normal. So we're going to put an N here. Bicarb 19 is also low. Downward arrow, and I'm going to put the word acid. This means my kidneys are driving the imbalance, so we call it a metabolic acidosis. Now to determine if there's compensation, I'm going to look to see if the lungs are helping out. Because it's a normal value, the lungs have not kicked in. So metabolic acidosis with no compensation. All right, so you ready to try another one? Let's go. Go ahead and work this one out for yourself and then come back for the answer. Okay, so 7.49 is elevated. It is an alkalotic state. I know that I have an alkalosis going on. I now need to determine which one. So go back and look at your CO2 value. CO2 value is 28. That's pretty low. That's also an alkalotic state. My bicarb is 20. That's also low, and that's an acidotic state. So here we have no normal values within our arterial blood gas. Again, look for the one that is going in the same direction, meaning is it alkalotic or acidotic? Does it match my pH? My CO2 is also alkalotic, so I have a respiratory alkalosis. Now, is there compensation? Has my kidneys kicked in? My bicarb is off to the side, and it is an acidotic state, which is what I would expect to kick in. But my pH is not normal yet. It's still working together really hard. So this we would call a respiratory alkalosis with partial compensation. Full compensation occurs when pH is returned to normal and our CO2 and bicarb levels are still outside of normal. All right, time for one more. Go ahead, pause this video, complete this on your own, and come back for the answer. So the pH 7.43 is within our normal range of 7.35 to 7.45, so we'll just put an N beside this value. CO2 at 34 is slightly low. We're going to put a downward arrow and identify that it is alkalotic. Bicarb is 21, also slightly low, downward arrow, and acidotic. So do I have an imbalance? Well, yes and no. Technically, my pH is normalized, so we can say that there is no imbalance. However, my respiratory system and my metabolic system have been working pretty hard to keep it there. So now to determine what imbalance my patient has just recovered from. We're going to start with the pH. What else? When we look at our pH 7.43, we can see that that is on the upper end of normal range. If we use 7.40 as our mid-range, anything above would be considered alkalotic in terms of identifying the acid-base imbalance. Just as with our previous steps, I now know I had an alkalotic state. I look for the matching level, which was my CO2 level, and I can say I have a respiratory alkalosis that is compensated. So there you have it. I hope you're still with me because I want you to know that the best way to master this is to practice it. Every chance you get, practice interpreting your arterial blood gases. Until next time, make it a great day.